I love sitting down to hear how Latter day Saint ladies are being guided by God to do what they do. In this episode, I sit down with a pelvic floor therapist to hear about her journey to helping 1,000 patients and her expertise in a muscle that is so often misunderstood. And as a caveat, we will be using anatomically correct labels in this episode, so keep that in mind as you listen on. But as you listen, you may learn something new about your body you never knew before. My hope in sharing every story on this podcast is that it will encourage you to tune into what God is asking you to do, and that it will give you the courage and permission you might need to do the thing, even if it scares you, and even if it looks completely different than you planned, or than what everyone else around you is doing. Welcome to Measure of Her Creation. Well, welcome to another episode of Measure of Her Creation. I'm so excited today to have Lyndi Payne here. She is a pelvic floor therapist, and I'm so excited to have this conversation because I think that this is a topic that maybe a lot of people don't know a lot about or hear a lot about, and it's something we all need to know about as women. And so I'm excited to delve into kind of Lyndi's experience becoming a pelvic floor therapist, but also the practical nature of it, like hearing a little bit more about it. So, welcome, Lyndi.
Thank you. Glad to be here.
Can you tell us a little bit about yourself? Just some basics.
Yes, I live here in Utah County. I grew up in a religious family. I grew up as a member of the Church of Jesus Christ and then came to BYU and started grad school and got married and have just stayed here in Utah. And we have a little baby coming on the way due here in a few months. And I love outdoorsy things. And I have two dogs and love them. And they're a little crazy, but they're super fun and they go on all of our adventures with us.
That's so fun. Where do you love to adventure the most?
We go to Colorado a lot, kind of in Telluride area, backpacking. There's a Via Ferrata course there, which it's iron rungs that are off the side of a mountain, and so you have to climb across them to get where you're going, which is a little terrifying, but it's fun.
So fun. I
But
actually did one
yes.
recently, so
Oh,
I'm
so
like
fun.
totally about that too.
Yes. Yes.
That's so cool. I'm curious how you're feeling about having a baby so soon. You're like way close. And this is your first.
Yes, yep, this is my first. Just really excited, nervous for lack of sleep, but can't really change that. So, we'll see how it goes. We're just excited to meet him.
Yeah, totally. Well, I would love to hear some of what led you to becoming a physical therapist, and then we'll jump into the pelvic floor therapy specifically. But what was kind of the inspiration behind that passion of yours and that choice?
Yes. So in high school, I wanted to do something in the STEM field. Had no idea what, but whenever I had friends that had an injury, I'd ask them what exactly it was. Like if they tore their MCL, I'd look up what an MCL was and all those sort of things. So
I
I
love
started
that.
just, yes, being really interested in anatomy and physiology and how the healing process all worked. And then when I got to college, I took a career class and looked into a bunch of different careers, and I really liked physical therapy. And I originally wanted to go to the Walter Reed Hospital in DC, where veterans go, and help rehab veterans from injuries in combat and amputations. Obviously, that's nowhere near where I ended, but that's kind of originally what got me interested. But I didn't want to go to grad school. So I played around a lot with nursing, dietetics, and I thought for sure I'd do athletic training, but I shadowed a lot of athletic trainers and hated the work schedule because I did want to be a mom and I didn't want to go to grad school. And if you don't go to grad school and you're an athletic trainer, you basically work at high schools, which means after school, weekends, nights,
A lot of
which
hours
is,
you didn't want.
yes, not good to have a career and be a mom. So then I switched back and just decided to bite the bullet, commit to going to grad school. My first semester at PT school, I actually we were going over anatomy of the pelvic floor muscles, and I actually told one of my friends that I'd do anything but that, and it's just very funny. Um,
So you've been through a
yes.
180.
Yes. And, kept to it all through grad school and clinicals, and then my first job right out of PT school, I had a bunch of mentors, and they were all male, and I saw females, obviously, 'cause that's half the population, and I'd say, "Okay, we're gonna do this jumping exercise," or "We're gonna do this," and they're like, "Well, I don't wanna do that because I'm gonna pee my pants if I do that." And
Mm,
so I'd ask my male mentors and like, "She doesn't wanna do this. What do I do?" And they're like, "Oh, tell her to do Kegels." And so I'd tell my patients that, and they're like, "Oh, I've been doing those for years and they don't do anything." So then I'd ask my mentors again, "Okay, that didn't work. What should we do?" And they're like, "Oh, well, if she's had kids, that's just how it is." And that just really didn't sit right with me. So I looked into being a pelvic floor PT, but was really hesitant. I don't even know why.
what were your hesitations?
I want to say originally probably just it's a whole new field and you have to learn a whole new different level of anatomy, physiology, complications, problems, but it also seemed a little awkward to me and
Can you explain why that might feel awkward? Because
yes.
maybe people don't understand what that entails.
So, with being a pelvic floor therapist, I knew that I'd have to do internal exams. So, looking at the vagina, looking at pelvic floor muscles, seeing how that would affect their physiology, affect how their movement patterns are. And I didn't really want to do that. It seemed way more medically involved than I wanted it to be. And I grew up in a very not sheltered, but I don't even know how to say it. Just, like, farts were awkward to talk about in my house, let
Very
alone
private.
yes, private, yes, let alone periods and peeing pants and all of that. So it was kind of a whole new dynamic I wasn't really sure I wanted to explore. So I took one course. So if you're in the medical field, you have to do continuing education every somewhat years. It's different for everyone, but I took a course as part of that in pelvic floor to just kind of see how I would like it, kind of dabble in it a little bit.
See
And the
how awkward
course
it was.
yes, the course went okay. Like everyone was very respectful. And then I started to see a few patients and realized it wasn't really as awkward as I was making it up to be in my head. And there's actually a lot of women, as I was talking to my patients, that have pelvic floor dysfunction issues, but they don't know it because it doesn't always look like peeing your pants. It's a
Mm.
whole big realm of other things. So that's kind of what got me really into it. And then, long story short, changed jobs to Reborn Pelvic Health and Wellness, and that's basically all we do. We do treat orthopedics, but we target towards women, men, and kids with all pelvic floor issues. And so that's when I got a lot of mentoring, really sharpened all of my skills, sharpened all of my clinical expertise and all my manual therapy. And now I'm deep dive in. I treat like 97% of my patients are pelvic floor related. So it's been
Wow.
awesome.
Yeah. Did you ever have any hesitations around I mean, obviously the awkwardness or kind of the challenge of should I go to grad school or not, but any other hesitations in going on this path, and what reassurance or guidance did you receive along the way spiritually?
I'd say the most hesitation was probably going to grad school because it's a ton of money. And my original life plan when I was 16 was to, get married. I wanna say maybe my sophomore year of college and then have a baby by my senior year and then pop out kids every 2 years for however many long I wanted kids, which is great for some people, but obviously that's not what happened,
Didn't
so
quite work out. Yeah.
yes, I, think my, going to grad school, I was like, "Oh, I don't know, that means I'm gonna somewhat commit to having a career," and that seemed a little more scary than all of the other things.
And maybe against the grain too.
Yes, against the grain, especially at BYU, and so with that, decided to go to grad school. I did go to the temple a lot, pray a lot, and just felt like, well, at the time when I was applying, I had no dating prospects in sight and wanted to provide for myself. So, like, well, it makes financial sense to go to grad school, get a degree, and if I get married along the way, that's great. If not, that's also great. I'll get married and have kids at some point.
We all have grand plans that just don't
Yes.
quite go the way we
Yes.
anticipate. Was that a wrestle or was that kind of easy to adapt to?
It was definitely a wrestle. I took a gap year between graduating from my undergrad and going to PT school. And I don't think I would have even gone to PT school if my mom basically applied for me. She told me what essays to write and how many letters of recommendation I needed and volunteer hours and all of that and figured out all the requirements. So
So
moms
you have a
are
champion,
awesome.
a champion of
Yes.
a mom.
Yes.
That is
Um,
very helpful.
yeah, so I think that took the stress off because I didn't deal with logistics a whole lot, and I more just worked on the actual requirements, but that was the biggest wrestle, and everything else just seemed to flow pretty nicely.
I love the word flow. I think that that is such a mark of God. Sometimes it's also a lot of challenge, but sometimes
Yes.
flow comes and it's like, okay, this is God kind of making the way for me in a path that you didn't expect, but is His path for you.
Yeah. It's been awesome.
As you're navigating having a baby soon and working in this profession you've worked really hard to get to, how are you navigating that with God right now?
I'm still figuring out my exact plans, but, ultimately, again, thoughts of prayer and temple time, but ultimately, my goal in life is to be a mom and a good mom, and a good mom looks different for everyone. So this is my personal what I need to do for me, but I am gonna work after I have a baby. Don't know how much time yet, but I also want to be with my baby and be able to raise him and not just have nanny time. So still trying to figure that out, but ultimately in the end, lots of things had to happen for us to get pregnant at the time we did. So right now, just having faith that it will all work out. I'm not sure how quite yet.
Hmm.
Um, but uh, just having faith that we were supposed to get pregnant when we did, and God sent us our little guy just at the right time, even if I don't think it's the right time. But
Can you share a little bit about that journey? Like, it's so easy to say, "Okay, like, I did grad school, I got pregnant," like,
yes,
all these kind of
yes.
milestones, but what was the journey there with getting pregnant?
We did have a little bit of fertility problems, and so my husband and we both did fertility testing, and at first they said it was unexplained, and then we had another doctor look at all of our results and found a problem on my husband's side. So he actually had surgery last year in May, and we weren't supposed to be able to get pregnant for a while after the surgery for the body to rehab, and then we got pregnant very, very fast. after the
Mm.
surgery, so I would say it was, planned and unplanned at the same time. Um, but it we were very happy to have him, but we thought we'd have a little more time to plan and get life in order.
Always on the unexpected.
Yes, yes, and my husband's surgeons were amazed and shocked at how fast the results were. It just
A
babies
miracle.
come, yes, babies come when they're supposed to come.
So, in your training as a pelvic floor therapist, and also with your experience with fertility treatments, what do you feel like you've learned about the body, God's plan with the body, the miracle of the body?
Yes, the more I learn, the more I learn we just don't know about the body, and the more it testifies to me that there is a God because the body's just so complex, and how a baby's made is a miracle even if you don't do fertility treatments, let alone fertility treatments, and I don't know who figured out all of the different options. But however they figured that out, I think is a miracle to let so many more families have babies. From a pelvic health perspective, I have a lot of patients that have really complex medical problems. To me, it just is a testament of God knows everything about the body, and even if I don't, lots of times a patient will come in and I'll be like, I in my head, I'll be like, I have no idea what to do with
Mm,
you, and I'll usually say a little silent prayer like, "Help me figure out something so that they can be in less pain." And those prayers have always been answered, even if we can't solve the exact problem, but also gives me hope that in the next life, my patients will be able to talk to God about their bodies and we'll be able to figure out exactly what's wrong and how to fix it.
do you feel like you have any specific experiences that you can think of? I don't know how HIPAA works with that, but just sharing generally a moment where you felt like you didn't know what to do and God's inspiration to you in your work.
Yes, a lot of complex pain patients, especially with pelvic floor related. A lot of them have a lot of psychological ties and emotions and past abuse. And so whenever I have a patient come in, it's typically their first appointment's a little emotional for them because it's not their fault they ended up in the situation that they're in. And so with that, a lot of my prayers are help me be able to be comforting, but also be able to help them and encourage them. I don't want to share too much, but had a patient, her parents were very abusive as a child, and she's been going to therapy for a while to figure it out. And she has hard kids that have other emotional things that make them just hard. And when I first saw her, there's just a lot of emotions. And so with her, I remember trying to just be able to figure out how to give her some relief and hope that things will get a little bit better in the next week or two. And then with that, we just slowly started working on her back pain, her pelvic pain, her hip pain. Typically, those patients have pain all over the place, but just slowly working away and feel just guided to follow the pain and figure it out.
Hmm. I'm sure you see a lot of the body holding trauma in your line of work.
Yes. Yes.
Like trauma that happened a long time ago is still playing
Yes.
out years and years later.
Yes. Because it's very, very common, like 50 years, 60 years.
Do you have any theories about that or thoughts about that? Because I think that's something, again, a lot of people don't really understand. Like, I think that's a
Right.
newer concept.
With pelvic floor, exactly, or specifically anyway, I a lot of it, if you've had sexual trauma, as a woman, your body tries to protect you quite literally, physically. And so, with a lot of my patients that have had sexual trauma, even if they're in now currently very healthy, loving relationship, they'll still have painless sex. With that, a lot of it is because when sex was first introduced to them, their body wasn't ready, didn't want it. So the muscles of the vaginal canal get really tight and constricted. And since it was quite an emotional, and I'm assuming most patients will have a little bit of PTSD from that of varying degrees, but your body remembers it. And so the next time anything tries to enter vaginal canal, whether that's speculum, tampon, menstrual disc, spouse, whatever it is, the body remembers and everything just clenches up really tight and causes a lot of pain. And then with that, if it goes on for years, surrounding muscles also tend to get tight. So leg pain, hip pain, abdominal pain, back pain, all of the areas that are surrounding that pelvis to try and protect you, which is really awesome originally. But sometimes the body just needs extra help to be able to let go and feel safe.
Yeah, it's beautiful that the body wants to protect you, and then you have to give it permission to relax and
Yes.
not protect you anymore when you are safe,
Yes.
which I feel like I'm working on a lot in therapy. And then
Yes.
but it's really like a dual thing, like, you need to come at it from multiple angles, so I think pelvic
For
floor
sure.
therapy is so vital for that. So, if I had literally never heard of a pelvic floor, can you just tell me what a
Mhm.
pelvic floor is? For
Yes.
all the ladies
So,
out there.
yes, your pelvic floor is the bowl of muscles that quite literally looks like a bowl, and it holds all of your organs up, not just your pelvic organs, but from here all the way down. So, heart,
So here,
lungs.
like, yeah, your heart down to
Mhm.
your
Yes.
pelvis.
Yes. So it has quite the weight on it on top of urinary, sexual functions, bowel functions, does all of that as well. And your pelvis, the way it is, it's a little into physics, but it's a circle and it transfers force between your upper body and your lower body. So, a lot with sports, being active, your pelvis takes a lot because it's what transfers power between your two sections of your body.
Whoa, that's so interesting. So, what would you say you said the more classic, issue is, like, incontinence, like, the more obvious
Mhm.
issue, but what other issues are pretty common that people might miss if they don't even know about their pelvic floor?
Yes. Hip pain, pain with sitting, tailbone pain, back pain, heaviness, feeling of heaviness anyway in your pelvic floor, pain with sex, having difficulty emptying your bladder, constipation, abdominal pain, endometriosis. The list could go on a
Wow.
lot.
What do you feel like has surprised you the most as you've met with clients? Like, maybe what they don't know about their own bodies or what they present to you?
I would say probably the biggest one is the disconnect in how women achieve an orgasm in comparison to men. Is pelvic floor issue also is having difficulty with orgasm. And there's a big disconnect there because how men and women achieve orgasms is very, very different. And so that's been surprising that I'd say maybe 75% of my patients don't know that.
Wow.
Yes. And so a lot of education there. And then on top of that, the other one is that men also have a pelvic floor. It's not just women.
That is informative.
Yes. Yes.
So how does that show up for men? If there are any men listening.
Yes. I don't treat men, but I have colleagues that do. But with men, it can be some similar issues, back pain, hip pain, if they have groin pain. A big thing is if they've ever had a hernia or an abdominal surgery, that plays a huge role in pelvic floor tension. Other big ones are if they've had prostate cancer, prostate removal. It tends to make everything nice and tight. Less commonly known, but are pretty common are post-void dribble. So if you pee and then you still have dribbles, that's actually a pelvic floor issue, not just something that happens. And then same thing with bladder retention, pain with urinating, constipation, and probably a few more that don't know the men quite as well as women.
Yeah, you work mostly with women. Actually, thinking about your work with women, I feel like a lot of women struggle with their body function in general, like mentally, right? It's frustrating to have pelvic floor issues. It's frustrating to have fluctuating weight when you are like having babies. It's frustrating to um sometimes like with breastfeeding. Like there's so many
Yes.
things that can be hard to have a female body. I've actually this
Yes.
very day have been like, "Why do I have hormones? I wish I didn't have hormones." Because
Yes.
hormones just, like, affect your emotions so deeply. But I'm curious, as you've worked with the female body so closely, how your feelings towards the female body have changed, and maybe your own body have changed.
Yeah. I'd say the biggest thing is that the female body is just amazing, and especially its ability to grow an entire human is so amazing. If you think about it, if well, you have your baby inside you if you're pregnant for 40 weeks and they're totally fine, but if your baby's born at 26 weeks, it takes a whole big chunk of specialists and equipment and millions of dollars to keep them alive versus the woman's body just does it, and it does it while you're sleeping, working, doing whatever, going about your day. The
Hmm.
woman's body is just so amazing in that it can grow humans. But on top of that, as you go through stages of life of puberty, fertility, getting pregnant, perimenopause, menopause, it's amazing how many changes the woman's body goes through, yet is still resilient, even if you don't feel that. But hormones fluctuate so much more than a man's body, but the woman's body is still just so capable of doing so many amazing things.
I love that word resilience. That gives me hope for myself. Because I do
Yes.
think the fluctuation can make you feel weak sometimes, and, like, pregnancy can make you feel weak, and all of these different
Yes.
stages can make you feel both weak and strong, I guess. And so I love that resilience that we can be battered, but, like, through all of these changes, but we can also be healed and come back strong. This is kind of a funny side note, and a very strong visual, so forgive me, but I am a doula, and
Oh,
in my
fun.
doula training, the midwife said that the vagina is, like, the most resilient part of our bodies as women because it's made for trauma, and she said, like, "Put 2 pieces of a vagina in the same room, and they will find each other." And I was like, "Whoa, that is, like, such a strong visual," but also kind of helps me to respect my body a little bit more because 'cause I'm like, "Oh, I'm if I believe that I'm made for trauma and made for healing and made for resilience, it changes the way I experience that trauma." And obviously, I wanna clarify, like, not sexual abuse or assault, but,
Right.
like, the trauma of bringing children into the world is is, like, a natural trauma that we go through. No matter
Yes.
how you get that baby there, it's like it's a
Yes.
traumatic thing for your body.
Yes. Yeah. It's amazing as I've rehabbed patients from all various birthing situations and scenarios. It's amazing how resilient the body is to knead itself back together and heal.
Are there any situations where you feel like it's something that is out of your hands to deal with the pelvic floor? Like, situations that feel kind of too extreme for you to deal with, like, it needs to be accelerated to something
For
higher.
sure. Yes. There's lots of conditions. For example, I don't know if you've ever heard of prolapse, but it's
Yes.
where, yes, organs are loose and coming and pushing on vaginal wall. We can treat prolapse if it's a grade 4, stage 4. That means that your whole organ is outside of your body. That is not in my scope of practice at all. Send them to a gynecologist for surgery. There's lots of conditions where we co-treat with MDs, DOs. A big one we see is pelvic congestion. It's where you have all of your veins in your pelvis are all engorged and become varicose veins. And so that's a co-treatment because it does cause um, pain in the pelvis, pain in the legs, and can cause pain with intercourse as well. There's usually a muscle component, so that one we refer out to a vein specialist and also co-treat with them after their procedure. But there's many things. Endometriosis, we don't cure that, obviously,
Yeah,
but we can help mitigate symptoms of that. But we're always referring to a gynecologist to either do an excision surgery and or manage medications on top of pelvic floor therapy.
that's good to know. So, I'm curious if there's anything that you hear widely talked about, maybe on social media or kind of thrown around advice by the layman that bothers you as a professional pelvic floor therapist? Like, what do you hear that maybe
Yes.
makes you cringe that you'd like to publicly correct?
For sure. The biggest one probably, is to do Kegels. I've had maybe 5 of my 1,000, maybe thousands of patients do Kegels. Uh,
Wow.
it's it's usually not the problem. Usually your pelvic floor is way too tight, not too loose and weak. So that's the big one. I'd say the other things, well, my husband's coworkers will ask him what I do for work. And he's like, "Oh, she's a pelvic floor therapist." And this kind of goes along with that. But they're like, "Doesn't she just get tired of telling people to do Kegels all day?" And he's like, "No, it's not what she does." But I'd say other than that, social media just kind of makes things sometimes oversimplified. If you see, oh, if you have heaviness after birth, do these 5 exercises. And that might help, but you might also have other problems that are wrong. And so every patient is different. And so advice you get on social media can help, but it's not specified to you. And so that's why I think people say, "Oh, pelvic floor therapy doesn't work," or "I've done all the pelvic floor exercises." You might have done some, but it probably didn't fit for your situation.
So for your situation, being you said 32 weeks pregnant,
Yes.
how are you as a pelvic floor therapist preparing for birth, and then what will you do to heal afterwards, knowing what you know?
Yes. So preparing for birth, the best thing is to keep glutes and core nice and strong. Glutes keep tension off of pelvic floor, which makes it nice and easy for baby to come out. So pelvic floor is not getting in the way. And then core, the stronger your core is, the less likely you are to have diastasis recti. So back like 20 years ago, um, pregnant women were told to never do anything with their core during pregnancy, and that's what leads to diastasis recti, which is the abdominal separation.
Bad advice.
Yes, very bad advice. So those are the big things. But as I'm getting closer to birth, working on hip mobility, as well as calming pelvic floor, stretches and calming breathing techniques because your pelvic floor isn't the one that pushes your baby out, it's your uterus. So, getting the pelvic floor to relax so the uterus can do its job.
Hmm. That's a helpful differentiator that I think a lot of people don't know.
Yes.
Your uterus pushes
Yes.
your baby out.
Yes. Pelvic floor, if you do a Kegel when you're trying to push, Kegel pulls everything up. So it just won't do much. The other thing I'm doing is perineal. Well, I haven't started yet, but around 35 weeks, I'll start doing perineal massage. And that helps stretch the muscles of the vaginal opening so that they're used to being stretched. So the first time isn't when my baby's crowning. So less likelihood of tearing or less of a tear.
I wish I had been more diligent at that.
Yes. So yeah, those are the big things. And then in general, staying active, the more active you are, shorter your labor is and shorter your push time. So for me, I like weightlifting, swimming, and walking. For everyone else, whatever their preferred method of exercise is. But for postpartum, you do wanna give your body a rest because it did go through quite the traumatizing experience, not necessarily mentally, but physically, just like you said, Michaela. Um, but there are stretches and exercises that I am planning to do laying down, so it is squeezing glutes, belly breathing, so big breath in through my belly, exhale, pulling my belly in, and then just some laying down stretches that are nice and gentle that first few weeks. And then as I get a little more mobile and hopefully we'll be out of diapers after the first few weeks, then I'll start walking, shorter walks at first and then very slowly reintroduce exercise.
I like that it's gentle. Like, even that breathing
Yes.
that you described, it's not like you have to hit the gym to get your pelvic
No.
floor back in shape. It's actually even just breathing that
Yep.
makes a huge
Just
difference.
just breathing
Intentional.
and yes, laying down so that your body can relax and rest.
So, okay, going back to the beginning, you mentioned you were a little bit more private in your family growing up. And now you've kind of gone to like this other extreme of
Mhm.
this is your work. You talk about like intercourse
Yes.
and vaginas like all day long. That's
Yes.
like your specialty. So I'm curious what you want to do with your children, how you want to teach them and maybe how you would hope, like, it's talked about at church, not necessarily the pelvic floor, but, like, sex and things like that.
Right. Yes. I think the big thing initially is using anatomical terms, as little kids. So instead of a PP, call it a penis. Because I think if we try and hide things, it makes it more exciting to say funny things, but it just the penis, the vagina, pelvic floor, it's all just a normal part of your body.
Takes the
I'll tell
taboo
'em
out of it.
yes. I tell my patients that, they're like, "How do you treat pelvic floor? It's, like, kind of gross." I'm like, "Well, it's the same as any other part of your body, I just use gloves instead."
Yeah.
Like, it's
Yeah.
just part of your body. So I think normalizing that, um, from a young age, but also to protect children, letting them know that this is private to just you and parents at first. So no one else should be touching your penis, your breasts, your vagina. It should just be you when you're going to the bathroom and when you're getting a bath. So starting off there. As my kids get older, in educating them about sex, I most likely will bring out a pelvis model. I'm a very visual
You're
learner.
scientific.
Yes. Um, and how I was taught, I was left with more questions than answers, and it just didn't really make any sense to me. And so I think being clear about how a baby's actually made. But then again, also teaching them the sacredness of loving someone and sharing that very intimate part with someone in a very committed relationship, marriage. But and just the special act of procreating. I think we need to talk about how amazing and special it is instead of not talking about it at all. And then when you get married, you talk about it for your bachelorette party and then you don't talk about it ever again. And
I know. I actually invited
yes,
Lindy to come to a Galentine's party where we are going to talk about pelvic floors and talk
yes,
about, like, all the things because I think that there's a way to keep it sacred, but also a way to take the scary unknown, the shame, the silence out of it.
right.
It's obviously a fine balance that you have to strike, but, like,
It
to
is.
to celebrate it, to find joy
Yes,
around it rather than like, "Oh, we just saved that for later," and then
yes,
never really rejoicing about it
right.
ever
And yeah,
again.
I have a lot of patients too that are that have pain with sex and they haven't had kids, or I have patients that are athletes and they pee their pants, but they're afraid to talk about it because it feels so awkward because we're all told to just not talk about any bodily functions from here down to your legs
Mhm.
because it's just taboo. And I think that prevents a lot of people from getting the help that they need earlier on, until they realize it's become a bigger problem. So I think that's also why it's important to educate your children, as well as it's okay to talk about things with your medical provider, because it's in a respectful way, not derogatory at all.
I think it's interesting with kids, kids are very black and white, and so it's
Yes.
either good or it's bad. We do it or we never do it, and so I think when any sexual feelings come up, any thoughts around sex, come into your mind, then shame is really easy to go to. Even if your young women's leader was, like, great at talking about it, we can internalize shame
Right.
so easily because
Yes.
we are naturally very black and white humans. We, like, see it as bad or good, and it's hard to hold space for nuance of it's like something sacred and something we don't do before marriage, and it's something we celebrate and love and do after marriage. Like, that's a really hard nuance to hold without
Yeah.
shame. And so I think that that's I think a challenge for kids to figure out and also a challenge for parents to figure out.
Yes, for sure. I'm sure, yeah, there'll be challenges along the way, but yeah, we can slowly start to change things over generations so it becomes normal to talk about bodily functions, but also teach in a respectful way.
Yeah, I love that. Well, I want to end by just hearing what you have learned about Jesus Christ through your work and calling as a pelvic floor therapist.
I think the biggest thing is to have compassion for people that are in pain, and that a part we get to practice as providers, medical providers, we get to practice just a tiny, tiny piece of Christ's power in healing people. And it'd be amazing to have Christ's full power of just heal everyone in one touch. Um, which I wish I could do, but I cannot. But I think it's just amazing to be able to recognize how amazing Christ is and how he can all heal us. And through treating patients, being able to heal them even just a little bit and a very small amount in comparison to Christ, you just learn about his genuine love and compassion for all of us. So I think that's just the biggest thing is love and compassion for everyone. Everyone has a hard life, but if we work together, we'll get through it.
It's beautiful to play a part in someone's healing. I love that. Well, thanks, Lindy, for joining us
You're
today.
welcome.
It was so good to hear from you.
Yes, thanks for having me.
If you enjoyed this episode, please share with a friend. Every share, every follow, every review helps this podcast reach more people who may benefit from hearing. All my love till next time.